hypothyroidism can lead to depression. Hyperthyroidism can lead to anxiety and insomnia. And sometimes when you treat the thyroid, the patient gets better.
Welcome to Baptist Health Talk, a podcast on all things healthcare, powered by Baptist Health South Florida, your trusted source for healthcare prevention and wellness.
I'm your host, Sandra Peebles. Welcome back to a new episode of Baptist Health Talk, where we answer your most searched questions on trending topics. Today, we're diving into one of the most misunderstood but essential parts of your body, the thyroid. Maybe you've asked yourself, why am I so tired all the time? Why can't I lose weight? Could it be my thyroid? Well, to help us understand it all, we are joined by Dr. Angel Alejandro, endocrinologist at Baptist Health. Thank you so much for being here.
Thank you for inviting me. I appreciate it.
Well, let's get right to it and let's keep it simple. Why is the thyroid so important to our overall health?
Well, we know that the thyroid regulates your metabolism. So what does that mean? It regulates your your blood pressure, your heart rate, your energy levels. You can really tell the difference on how important the thyroid is when it's not working. When you're hypothyroid, when you don't have enough thyroid hormone, you're very tired, you're fatigued, you gain weight easily, you're very cold when everybody's hot. But when you're hyperthyroid, it's the exact opposite. You're nervous, you're agitated, you can't sleep, you're losing weight, you're having frequent bowel movements. So you can definitely tell when things are off.
Well, a lot of these symptoms could be mistaken for something else, right? So when we talk about mood swings, we talk about losing weight or gaining weight or not being able to lose weight. All of these symptoms can be confused. So how do we know it's time to check the thyroid?
Right. So it's difficult because sometimes it's tough to tease out the exact cause of your symptoms. For example, a patient may feel very tired, but their thyroid's absolutely normal. Maybe they have something called obstructive sleep apnea, which causes daytime fatigue and sleepiness. So we do screen this. When you do go to your primary care physician, they should be checking. And if they're not, you should ask them to at least check your thyroid levels once a year. And if it's abnormal, then we can address it.
Okay, so if someone is at home listening and saying, yeah, that's me, I can't lose weight, I can't sleep right, what's the next step? Do they do blood work, check with their doctor? How is it that we know if the thyroid is off?
Right. So the next step is blood work. There's two labs that you want to look out for. One is called the TSH, which is your thyroid stimulating hormone, and the other is the free T4. Essentially, the TSH comes from your brain, and it's the hormone that stimulates the gland to make more. So if your TSH is high, it means the opposite. It means that your thyroid levels are low. And then your free T4 is like the dipstick of a car, right? How much oil do I have in the tank right now? The free T4 will tell us how your thyroid is working right now. So the TSH will give us an average. The free T4 tells us right now how things are going. And then I use the combination of both to determine what the next step would be. But you can definitely get that blood work done through your primary care provider.
And that's pretty easy. Just let them take your blood.
It does not have to be fasting. Lab. It can be done any time of the day. And they send it to the lab, and it usually comes back within 1 to 2 days.
As you know, the magic of this program is that we do top searched questions. So it's what people want to know.
Okay.
And one of the things that people are asking is that 3 o'clock wall. You know, when people hit that wall at 3 o'clock, they have no energy. Could that be a thyroid issue?
It could be. It could be. I know that there's a lot of stuff out there talking about adrenal fatigue, and then we can talk about that another day. But it could be your thyroid. You start the day well, and then you kind of, your energy levels start to diminish throughout the afternoon. It could be a thyroid-related condition. But as I mentioned, it could be many other things, but it's a good place to start would be to check your thyroid levels.
Okay, so many people want to do natural healing. Many people want to do things to prevent. Are there any natural ways to treat a hypothyroidism or underfunctioning thyroid?
Right. So natural supplements, you need to be careful. There's all these products called thyroid support. And unfortunately, a lot of them have actual thyroid hormone in it. There was a study done in 2015, and they found that 9 out of 10 supplements actually had thyroid hormone in it. So it's not really supporting anything. It's just giving you thyroid hormone. And if you're not monitored, hyperthyroidism can cause problems with the heart.
So you can actually switch it by taking the wrong thing.
Correct. So you have to be very careful with these thyroid supplements. The only natural supplement that's been shown to be safe and probably effective would be selenium, which comes from the Brazilian pine nut. Selenium has been shown to reduce inflammation of the thyroid and prevent patients with Hashimoto's, which we can talk about later, from developing overt hypothyroidism.
What about foods? Because I know nowadays many people want to eat specific foods that might help them, strengthen their immune system. Are there specific foods that we should eat or maybe stay away from?
Well, once again, there's a lot of options. If you Google hypothyroidism, they talk about selenium, they talk about iodine, for example. You just have to be careful. Remember that iodine, we use it in the hospital for patients who are hyperthyroid to actually shut the thyroid down. So you got to be careful with these things. Natural supplements are just that, supplements. But at the end of the day, if you are hypothyroid, the best option for you would be one of the thyroid preparations, either Synthroid, Levoxyl, levothyroxine, Unithroid. These are medications that have been proven to be safe and effective.
But in order to get on medication, you have to be at a certain level.
Correct. You need to have an elevated TSH with symptoms, right? So you can have symptoms, but if your labs are normal, then it's probably not a thyroid condition.
Okay. Yeah, because it's important to clear that up, that maybe not everyone needs to be on medication.
You're absolutely correct.
Maybe just better lifestyle.
And for example, with elderly patients over the age of 70, you want to be careful because you don't want to do harm by providing them a thyroid medication when maybe they don't need it, because the elderly patients over 70 are at higher risk for palpitations and arrhythmias. So you have to be very careful.
I know I'm going to get into murky territory here, but we don't often associate emotions with thyroid. But is it possible for someone to have a low mood, depression, anxiety? Could these things be a sign possibly of a disorder?
Depression, hypothyroidism can lead to depression.
Wow.
Hyperthyroidism can lead to anxiety and insomnia. And sometimes when you treat the thyroid, the patient gets better. So it's very important. I have a lot of my psychologists who refer patients to me because they check a thyroid level and they see they're hyper. Well, that explains the anxiety. So let's attack the underlying problem. Imagine you can fix anxiety. I can give you a pill for anxiety, but that's just a Band-Aid if you don't solve the underlying problem, which in some cases is in fact a thyroid condition. Yeah,
but it could be so many other things, right? So many of these symptoms that we've spoken about could be thyroid or something else. So it's kind of like for you doctors, I'm sure it's like being an investigator where you eliminate this possibility, eliminate that.
I find it fun. But
you find it fun,
I find it
like
fun.
A detective.
But you have to be careful with the thyroid. I know a lot of times you want to blame the thyroid, but you have to be very careful because, as physicians, we want to do no harm.
Of course.
And we're talking about a medication that may be for life, right? So you have to be 100% sure the patient needs the medication before you start.
That leads us right into the next question, because there are many myths surrounding thyroid health and how to treat thyroid. So is it true that once a person is on medication for thyroid, they'll have to be on it for the rest of their lives? Or are there cases where people can slowly come off of it?
No, it's true. Once you're hypothyroid, you are hypothyroid for life. Okay. What happens is you have to imagine maybe your gland doesn't make 50% of what it used to. Then I have to replace the other 50%. And usually what happens is the opposite. You need more thyroid hormone over time because as that thyroid begins to produce less and less, I have to provide more and more. The only exception would be hyperthyroidism, which is different. To treat hyperthyroidism, we use anti-thyroid medications, which you use for about 6 to 12 months, and then you stop because usually you go into remission.
So it's kind of both things are true.
Correct.
Interesting.
So with hypo, it's usually forever. With hyper, a good number of them go into remission, and then you don't have to take the medication.
Wow, this is great information.
We're learning.
Yeah, definitely. And it's something that's often talked about, especially now, because there's more and more cases coming out. So it's a conversation that's had, but it's good to clear up those myths. So let's keep going with the myths.
Correct. Okay.
And let's go to the food. Some people say eat or don't eat broccoli, kale. Are those foods safe?
There's most definitely these foods are safe. The concern has been with broccoli and kale that they may reduce your absorption of iodine. Okay. However, if the broccoli is steamed or cooked, if the kale is steamed, if artichokes, for example, if they're roasted, that effect goes away. So as long as you cook them and you eat them in moderation, you should be just fine.
And so what is it in the broccoli or the kale? Is it oxalate?
It's a substance that for some reason affects the thyroid's ability to absorb iodine, but that protein is broken down by heat. So if you cook it or steam it, you should be just fine.
I've seen a lot of things on social media. People say, stay away from gluten. or put in iodine or put in seaweed in your smoothies. What's real and what's just Instagram hype?
Well, hypothyroidism is an autoimmune condition. That's where we have to take a step back. So what is the number one cause of hypothyroidism? It's something called Hashimoto's thyroiditis, where you make an antibody that is attacking the thyroid, creating an inflammation that destroys the gland over time. So it's an autoimmune condition. And there have been several studies with autoimmune conditions and gluten, right? And going on a gluten-free diet or a low gluten diet may improve the autoimmune condition. So that's, it's not a bad idea, but a gluten-free diet is hard to do. So what I do is...
Because there's no bread.
Exactly. We're in Miami. So what I do, if you have Hashimoto's, right? If you have an autoimmune condition, I will check the antibodies for gluten. And if they're positive, then we have to make a choice. If they're negative, then you probably don't need to go on a no gluten diet. I think about 10% of patients with hypothyroidism will also have the gluten insufficiency. That's more than the general population. So you definitely want to check. In terms of iodine, salt has iodine, and there's a reason for that. In the 1920s, in the central of the United States, Michigan, or that area there, Ohio, they had a lot of goiters, which means you had a big thyroid gland. And they realized that it was from iodine deficiency. So that's when they started putting iodine in salt, and salt is iodized. So we don't have that problem in the United States anymore. We don't see those big glands anymore because salt has iodine, and we know iodine is the fuel for the thyroid. So you don't have to go get iodine supplements. You don't have to drink kelp, all these seaweed preparations. There's plenty of iodine in our diet. And like I mentioned earlier, excess iodine is actually bad for the thyroid. It actually shuts it down.
Very interesting, right? Because people might think, I can go out there and handle this and do preventative medicine, which so many people want to, right? They want to take control, but it could actually have a negative effect. And speaking about that, are there supplements that people might be taking, non-thyroid related, that could actually interfere with their thyroid health?
Well, there is one supplement in particular called biotin, which a lot of women take for skin, nails, and hair. But it doesn't interfere with the thyroid per se. What it interferes is with the lab, with the TSH level. It interferes with the assay. So patients that take biotin, we do ask them to stop the biotin about a week before they have their labs drawn. So there's no interference with the TSH because it could be falsely elevated and you really don't have hypothyroidism.
But if you're a healthy person, is it okay to have the biotin?
It's absolutely okay.
It's not going to actually...
It only affects the lab. So if you're going to have labs done for the thyroid and you're on biotin, you want to stop about a week before.
Okay. Now, a lot of people associate thyroid conditions with females. Is it equal for male and females, or do you normally see in your office women?
Well, it has to do with the fact that hypothyroidism is an autoimmune condition, and autoimmune conditions are more prevalent in women than in men. So that's why we see more women with thyroid conditions than men. Doesn't mean that men can't get hypothyroidism, because there is a genetic component as well. But yes, we see more hypothyroidism in women than men because it's an autoimmune condition.
Okay, now let's talk about things that aren't myths. These are not myths. Let's talk about nodules, because it's something that's very common and often found during scans. What exactly is a nodule and what could it mean?
Okay, so a thyroid nodule is just a collection of cells that have grown over time and they start to clump together. They form a little tiny ball inside of the thyroid. So think of an apple. You have to cut the apple open to see the little black seeds inside. Nodules grow inside the thyroid gland. What's important is that the majority of them are going to be benign. Okay, so we don't have to freak out. They're very common, but the majority are benign. For that reason, we follow nodules with ultrasound. And the ultrasound will allow us to know who needs a biopsy and who can just be followed up over time based on the imaging characteristics of the nodule. So if you have thyroid nodules or you feel a lump in your neck, the next step would be an ultrasound. And then based on the ultrasound findings, we can tell you whether we're just going to observe, whether there's nothing to do, or if we have to proceed and obtain a biopsy.
And of course, I can't help. I want to feel and see.
Right.
Of course, right. I'm sure people at home right now are doing the same exact thing. You're like, oh wait, do I have a nodule? But it's not necessarily a bad thing. You don't necessarily have to have a nodule removed.
Correct.
You could live with it.
You can live with it your whole life. And that nodule, I guarantee you, didn't grow overnight. It's probably been there for a while. We find things a lot of times by mistake. They do a CT of the neck because you have cervical pain. We see the thyroid, right? They do a CT of the lung to look for nodules in the lung, and you see the bottom part of the thyroid. So we do find these nodules a lot of time by mistake, and usually they've been there for a while and there's absolutely nothing to do, but you should get it checked. We need that ultrasound to see the characteristics, to see what kind of risks you have, and then we go from there.
I've seen a lot of young people that have been diagnosed with thyroid issues in general. I'll just leave it like that. But is age a factor? Do you, as we get older, of course, we become more susceptible to all kinds of conditions. Is this one of them?
Yes. So we know that the prevalence of thyroid nodules increases with age, right? So that's important. So older patients, if you look, they're going to have nodules. Younger patients with nodules, that's what, you got to be a little more careful because it's not so common in younger patients. So if you see a younger patient with thyroid nodules, then you definitely want to be a little more aggressive. You want to get that ultrasound. You want to do that biopsy and just make sure everything's okay.
Do you think that as we get older that we should ask our doctors, please test for this? I mean, they probably would.
Yes. I mean, it's to have a baseline ultrasound does not hurt. Remember, ultrasounds don't have any radiation or anything like that. If you have a concern, then you can look.
And what about running in the family? What about?
Well, that's what I was going to get to that. Yeah, you got me on that one.
I read your mind.
So thyroid nodules, there is a genetic hereditary component. So for example, my father has thyroid cancer. He's doing just fine. But for that reason, I get my thyroid checked, right? Because I am at a little more risk than the general population because of my family history. A lot of us know aunts or even sisters that have thyroid conditions. Well, remember, it's a hereditary component. So you definitely want to get your blood work checked if you have a family history of thyroid disease in your family. Even
in the worst case scenario, though, thyroid cancer is very survivable. From my experience, from people I know, you tell me, doctor.
Extremely.
Is that true?
Yes. I mean, cancer is cancer. We hate that word. There's no doubt about that. But a diagnosis of a thyroid cancer is not something that you really, really have to worry about other than getting it treated, right? We take it out. We give you radiation. We may or we may not, and you're good. Okay? Surveillance. We follow you over time. But the survival rate for thyroid cancer is exceptional. It's one of those very few cancers that you don't go to see an oncologist, right? You'll see your surgeon, you'll see me, and we'll take care of it. So it is not the end of the world is what I wanted to say. Yes, it's something that needs to be addressed, but it's something that's very controllable and very curable.
And I'm glad your father's doing well.
Thank you so much.
This has been a great conversation. I really learned so much.
Thank you for your time.
Despite the fact that I read and I get ready for the interview, the truth is, speaking to you, I've learned a lot. So thank you so much,
You're welcome.
Dr. Alejandro. Well, remember, viewers, be sure to hit that subscribe button on your channel here to keep up with the latest health and wellness information and tips from our experts. Thank you for watching.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Baptist Health Talk is brought to you by Baptist Health, the warmer side of care.